that's my soapbox rant for this presentation, if I haven't already done one already. But the last thing I want to talk about is metaplasia. Metaplasia is basically is typically a reversible change that occurs in tissues, which is very commonly associated with. Well, goodness gracious, I'm sorry. Basically with constant exposure to irritants, and I mean the best example I can think of is smoking. Shouldn't say I can think of. This is just the most commonly talked about one. So remember that your conducting airways are lined with pseudostratified columnar epithelia. It's a mouthful, right? Epithelia. All right, and so basically we call it pseudostratified because we've got these long columnar cells, these shorter basal cells. All right, again, this is a part of my horrific art here, but these columnar cells, blah blah blah, shorter cells. All right, and then these are then we have a base like any other epithelial tissue. There's a basement membrane. We call it pseudostratified because it looks like it's multi-layered, but it's not. It's just that some cells are taller than the others. All right, these columnar cells are much taller than these shorter kind of basal cells that are located here. Now, the really important part with this is the cilia that's associated with the lining of your respiratory tract, your conducting airways. So the cilia and the mucus that lines it. This is a good educational moment. What's the difference between mucus and mucus? M-U-C-U-S and M-U-C-O-U-S. M-U-C-O-U-S is more of an adjective, and you're using it to describe, it's typically used to describe, goodness gracious, mucous membranes, whereas this is the actual secretion. The snot, the lung nuggets that you cough up, and so on. All right. The stuff that nobody wants to see when you spit it out on the sidewalk. So please spit it in the grass, people. But when you take a look at this, what happens here when someone smokes, especially I'm not saying that if you just breathe in some secondhand smoke or if you have a cigarette, a smoke once in a while. I'm talking like chronic smokers. All right, what happens is this cilia is going to shut down. All right, the cilia is going to shut down. All right, and then what's going to happen here is when the cilia more or less kind of becomes paralyzed and non-functional, what you have here is this tissue essentially reverts. All right, this epithelial tissue is going to revert from the pseudostratified, columnar to more of a stratified, kind of a squamous type cell, kind of flattened, non-functional cells. But like I said, this is a reversible condition. Now, obviously, this isn't a good scenario here because whether it's smoking or not, we are breathing in air, so the inside of our body is exposed to all the junk in the air that we breathe in all the time, right? So we need the mucus, so we need these mucus secretions to trap and filter air that we breathe in, and we need the cilia to propel the mucus out. All right. So basically, that's why chronic smokers, people who've been smoking for a few decades, are going to eventually they're going to get sick more often. I don't know if you've noticed that, if you know anybody that's like that, but they're going to get sick much more often because what's going to happen is you're going to have all this this mucus is going to just kind of accumulate in the lungs, and you're going to breathe in pathogens and irritants, and you're not going to be able to really filter them out due to the non-functional cilia. And then remember, mucus is just mucin. It's supposed to be an N, sorry. Mucin plus water. So basically, it's a protein and water mixed together. All right, so what you get here is this is a great food source for organisms to grow. I used to take care of one of my residents was a combination quadriplegic and had cerebral palsy, and also smoked. Obviously, you have to remember, patients have rights, residents have rights, they can make their own choices. It's our job to educate them, but if they want to do that, you can't stop them. This isn't, it's like I said, patients have rights. And I understand why. I'm not saying I agree with it, but I understand because, that was one of the last things that resident had control over, that particular vice, and wanted to do that. But at the end of the day, when this individual didn't smoke for a while, the mucus that was coughed up was the same color as the lettering that you see here. And then no matter how much we try to tell that person that, look, this isn't good for you, here's what's going to happen, didn't listen, and wound up getting pneumonia. Survived it, came out all right, but wound up getting pneumonia eventually. So obviously, what's going to reverse this? We'll remove the irritant, right? In this situation, obviously you need to cease smoking, and it'll take couple months for these, depending on how long you were smoking for these cilia to wake up, and for mucus secretions to get back up to normal and get this mucus out of there, and have that horrific coughing for a little while, and then I mean physiologically, I mean you're pretty much clear to smoking, physiologically, within a month to 2 months. It's the psychological aspect of smoking that's an outright challenge to try to kick, and that's what gives people such a hard